what are the reasons behind doctor burnout and what are the ways by which you can prevent this burnout. If you are a doctor, then you must watch this video because it's a very super sensitive topic and it's a very serious condition and you should be aware about this. Hi, my name is Dr. Nitin and I run this channel for doctors so as to help them live a very balanced life so that they grow professionally, personally with a appropriate work-life balance. So if you're watching this, if you're first time on this channel, I want you to subscribe this channel because on this channel I will share various tips, tutorial ideas, strategies related to growing your clinical practice, your clinical setup, hospital, or in a diagnostic lab. But along with that, I also care for my doctor fraternity, and I also want to live them a healthy, happy, and satisfied life. So I request you to watch this video along with your family members also, because you are not just living for your patients, or you're not just working for your organization. You have responsibility for your towards your family, towards your spouse, towards your parents, or towards your children. And if you want to fulfill that responsibility, first you need to be efficient and in well condition to take on that responsibility and the challenges. So we are going to discuss about what is this thing called doctor burnout and why this is happening and why we need to talk about this. What are the different causes behind this doctor burnout and why you should consider it? And are there any prevention and intervention strategies that you can adopt and make yourself free from this burnout situations? So this video is going to be slightly lengthy, but it's going to be super helpful, and it is very. I'm going to talk about various practical aspects, and it matters for your life. It's more than I would say. This is very critical than attending any CME also. You can always upgrade your clinical knowledge, but once you are unhealthy and your health is damaged, you cannot improve that. So that's why we focused on this video, and let's talk about what is this doctor burnout. So it's basically a state of chronic physical and emotional exhaustion. So as you can see, it's a chronic condition and it often accompanied by various symptoms which you might neglect. And most often it has been seen that doctors are neglecting this kind of symptoms. We will discuss that shortly and how it's going to impact not your personal but also professional life. So that's why we need to consider this situation very critically. Then you can experience a plethora of symptoms, right from physical symptoms, emotional symptoms. It can impact your cognitive behavior, behavioral activities. It not only affects your personal health, but also affects your professional attitude. It impacts your interpersonal communications and it impacts your patient. So let me read out all the symptoms one by one for you. So it creates fatigue and exhaustion. You can experience sleep disturbances, headache, migraine, muscle tension, and pain. You will also experience a lot of emotional symptoms. The critical are persistent feeling of sadness and hopelessness. You can experience irritability and mood swings. You can experience anxiety and panic attack. You can experience sense of accomplishment. You can see these changes in your cognitive abilities. You will be unable to focus on things. You will have some memory problems. Your decision making will be hampered, and your attention and focus span will be reduced. It will also impact your behavior. You will be withdrawn from your colleagues and patients. You will be maybe addicted to alcohol and other substances, or maybe some other modes of addiction. You will change your habits. You will start procrastinating. Your efficiency and productivity will be decreased. You will avoid any responsibilities which you might not feel to take on. You will also experience some professional impact. You will have decreased job satisfaction. You will have increased cynicism, and you will be detached from your work. You will lose any empathy towards your patients, and it will impact negatively on that professional relationship with your patients, with your colleagues, with your superiors, with your juniors. You will be having a strained relationship with your colleagues, friends, office, and not only at workplace, but also in your home also, with your family members, your children, your parents. You will be unable to maintain a proper work-life balance. You will be socially withdrawn and you will start living in isolation. You will have decreased interest in social activities. You will face cynicism and depersonalization. You will develop a negative and detached attitude towards your patients, and it will reduce your ability to treat your patients efficiently in an appropriate manner. And you will treat them as objects, and you will just focus on the symptoms and critical problems rather than focusing on the root cause. You will lose that empathy and compassion in your patients. So these are the long list of symptoms, and there will be multiple more symptoms which may not be listed here. So I hope you are still with me now in this session. I would request, this is going to be long video, but this is very super serious topic. And here are the few reasons why you need to consider and watch this video completely and do the introspection in your life. Why you should consider assessment into this aspect. Because various studies, research studies have shown that more than 90% of people experience some or other form of burnout. I'm talking about doctors, not any other profession. I'm talking about doctors, practicing doctors. 44.3% of doctors are at the risk of developing this burnout. 13.5 have shown severe risk of burnout. 16.6 have shown very severe risk of burnout. 24% of doctors have reported emotional exhaustion. 27 have shown depersonalization. 23% have shown diminished or reduced personal accomplishment. They were not satisfied with their job. They were earning, but they were not satisfied with their work. Almost 50% of have shown at least one or other symptom of burnout. 30% of doctors have shown symptoms of severe depression. So if you ask me why, if there are so many symptoms and if this problem is so critical, why the doctors are not coming out, why they are not considering. They consider these symptoms as one or other symptoms, and they get into some this diagnosis bias, and they feel that I know this thing and I can manage this, and maybe they feel that it's a temporary and it will go away. My dear doctor friends, let's not take these symptoms lightly. You need to get any kind of help, because some doctors might be feeling that it's a stigma. If I come out with this kind of things, it will show my weakness, or it will impact my clinical practice or my hospital business. So let me ask you, if that may cause some short-term damage to your business, but This kind of symptoms is going to cause a long-term and lifelong damage to your personality and your health. What you will choose? If I was in your place, I would definitely choose the long-term solution to this problem. I was also having some of these situations in my previous job. That was a very stressful job, and I took severe actions, and I I created my work-life balance for myself. Before these symptoms overtook me, I took overcharge of this symptom. So some of let's understand what are the causes that most of the doctors might be facing. So we can group various conditions or causes into these categories. It might be related to workload and long hours of work nature. It might be related to some emotional and psychological stress related to your work, finances, superiors, or your team, or maybe even family members. There might be a lack of work-life balance, as I mentioned. Most of the people are facing it, but they are not ready to accept it. If you can accept this, you can definitely solve this problem. The very first step is to accept this problem. Some doctor might be facing administrative burden related to documentation, some kind of reporting. So let me ask you why you should consider this. There might be different reasons, but these are the some things which I feel you should consider because it is going to impact your patient care capabilities. And if you are unable to so, serve your patients, you are definitely going to lose your patients and your clinical practice, your business sooner or later. So let's take control of that situation and work on those symptoms be, be- till the time you are able to control it. Once your this situation goes out of the control, you will not be able to get back the patient aspect. You will have a decreased job satisfaction. It might complicate with a higher rate of medical errors. And definitely you want to avoid it this because it might lead to some medical legal complications. That's why I am uh, requesting you from bottom of my heart, if you're facing any of these situations, please take a help. You might see an increased turnover or and shortage of healthcare professionals if you are managing a team or we are managing a staff, you are a hospital owner, you might need to consider this aspect because your team of doctors is facing this situation. You will see many doctors leaving your hospital or your clinic setup. So that's why you need to take it seriously. So there are certain ways by which you can solve these problems. So first of all, you can reach out for support, and those supports are available. Even if you want to maintain that confidentiality, you will get that confidentiality. But first, you need to reach out for this kind of mental health support programs. Then you need to improve your work conditions by reducing the workload. You need to figure out some ways, either use of different team members or maybe some tools, or maybe if possible, you can outsource some of the things to some outside team members so that you get that reduced workload. So you can improve your work-life balance and you can address the administrative challenges by again taking some team member help or maybe some outside vendor. You can reduce that administrative burden. You can implement various policies for your doctors. If you are a hospital owner, you can uh, build various programs so that you can support those kind of your team members, and they will be staying with you for forever because when you are helping them in their difficult time, definitely they are going to support in your difficult time. So you need to implement these policies for your team members. You need to create a positive and supportive work culture if you are owner of the hospital or the clinic or your healthcare business. You need to create that culture so that that culture not only helps you, your team members also, and it gives a win-win situation for all the staff members, for your patients, and last not but the least is become part of the community, because when you are part of like-minded people's community, you get to uh, have a better control over this kind of difficult situations. And I invite you to become part of this community. I will share that link in the description or the comment section of this video. You can join this community just by for free. Apply a coupon code I have mentioned in the description and the comment section. Join this community for free, and you will get access to various tips, tutorials, strategies, ideas, resources related to improving your personal professional life. You with the complete satisfaction, you will be able to solve most of this problem, because this community is designed for doctors to improve their lifestyle in all the aspects, not only the financial aspects, but their personal and their behavioral and their brand value. All the aspects will be addressed through this community. So I invite you to become part of this community. And if you have joined this community, let me know in the comment section. I also invite you to share this tutorial with your friends so that they also get aware about the severity of this problem. And if you feel that this video was helpful and useful for you, please give me a thumbs up, because when you give this kind of support to me, it gives me the motivation that I am being able to help my doctor fraternity. And it also helps the video to reach more and more people so that they can also get benefit from this video, and they improve their mental health, they reduce their mental burden. And I hope this video was helpful for you. If you are not subscribed to this channel, please subscribe to this channel, because I share various tips, tutorial ideas, strategies related to growing your clinical practice, clinic, hospital setup. So we'll meet again in next episode. Till then, I'm signing out. Bye bye. Thank you. This is Dr. Nitin signing out.